continue to use inspections that prioritize complaints and critical incidents that pose risks to residents, allowing inspectors to respond more quickly. And coming from a backlog under the previous government of 8,500 critical incidents and complaints, the efforts that were made by the Ministry of Health and Long-Term Care in 2018 to address the inspections process is something that our Ministry of Long-Term Care inherited, and understanding the importance of addressing a backlog of 8,500 critical incidents and complaints is necessary. We have heard what the Auditor General has said in this area and are in the process of developing a plan to make inspections even more effective and resident-centered. Our government is fixing a broken system. We have invested $9.6 billion into making long-term care a better place for residents to live and a better place for staff to work. And I would like to thank the Auditor General for her recommendations and her insights, and we will review them carefully as part of our ongoing pandemic response. So thank you. So in terms of getting to your question, in terms of the responses, the response by long-term care to the pandemic was an integrated response with the overall healthcare system. The long-term care system and our ministry, we don't operate in a vacuum. It was an integrated approach with public health, the Chief Medical Officers of Health, the Associate Chief Medical Officer of Health, the acute care sector. It is an integrated approach and multi-ministries. So in terms of our response, you heard the Auditor General mention, it was essentially hospital-focused initially. That was her insight. And to say that long-term care needs to be more integrated with public health, inspectors, public health actions. You heard her say that as well. And in terms of our acute care sector, understanding how those go hand in hand. When long-term care works well, the acute care sector will work well. And so they need to be good partners. And certainly we've relied on the acute care sector over the last year to assist long-term care, and we certainly appreciate everything that they have done to support the long-term care sector, as well as our medical officers of health, our public health groups. But this is an unknown virus initially, and the scientists are still disputing certain aspects of transmission, including aerosol spread. So you can see that there's unfinished scientific evolution here.
Minister, I'm hearing your response. You're casting a lot of blame on the previous governments for not doing enough here. But obviously the report highlights actions that this government could have taken, and I'm wondering, frankly, does the buck not stop with you as minister here in terms of the inspections, in terms of the staffing situation? Doesn't the government bear some of the responsibility in this?
Well, absolutely. I spent my almost 30 years as a family doctor and 15 years researching long-term care. It's why I came to politics. I don't think anyone anticipated a pandemic that would be global, aerosol spread, potentially a predominant mode of transmission. And in the early days, the understanding of how the transmission occurred was not fully understood, as well as the asymptomatic spread. So we're dealing with a new virus globally that has impacted countries around the world, including long-term care homes around the world. So as someone who was trying to get here to solve the long-term care issues, it's why I came. Professionally and from personal experience with family members, and then to be hit by the structural inadequacies, not only in staffing, and everything comes back to staffing, the structural inadequacies, the crowded homes, the 1970s homes, the promises from the previous government to rebuild and redevelop 35,000 spaces, which never happened, the 2008 report that they had on staffing that they never acted on, the 8,500 and more critical incidents and complaints that they let build up, and then walking in, knowing that we have capacity issues, hitting the ground running as soon as we became a ministry, addressing Justice Scalise's report, addressing issues within the home, getting a staffing strategy going, finding out why there weren't more homes built. And we did that in months. And then the pandemic hit. So we were a standalone ministry created to focus on long-term care, following the commitment by our government to build 15,000 beds in 5 years and create capacity that had been so sorely neglected. So the responsibility, it's kind of like running into a burning building. You know, you're trying to save it and you're doing your very best, but the fire had started well beyond the pandemic. And so I think it's our government that is a government that is committed to this. And, as I said, almost $10 billion just really committed in the last year to this. Something that could have been addressed. Everyone knew it was an aging population. It's no surprise. We've known that for decades. And so, here we are with a global pandemic. We have no vaccines. Our PPE's in short supply. The testing reagents can't be found. It's a global competition. And so everyone, including public health, including the hospitals, and personal support workers, our frontline, everybody working round the clock, including thousands and thousands of people in the Ontario Public Service, trying to address this global pandemic. So do I accept responsibility for all of that? I'm not a public health expert. I'm here to try and fix long-term care. But if the building's on fire and you're running into it to try and save people, yeah, I think that's pretty much what we tried to do. But we didn't start the fire.
Let's go to the phones.
A reminder to press star 1 if you have a question. First will be Mike Crawley at CBC News.
So, Minister, just to follow up, what exactly do you take responsibility for?
Well, absolutely. So as the Minister of Long-Term Care, I have a responsibility, a duty, an obligation, and I've used those words here to residents in long-term care, to the staff in long-term care, even though that's primarily done through the Ministry of Health. But in terms of really raising the importance of long-term care and addressing the shortcomings, addressing the failures of the previous government, yes, I'm doing that. And that's seen in our monumental commitment to the 4 hours of care. There's report after report after report, Mike, talking about the 4 hours of care, talking about the importance of doing that, and reports littering everywhere. It was plain to see. Why didn't the previous government act on that? I don't know. They had other priorities, obviously. But our government is committed to doing that. And the 1970s homes, we got 78,000 people in long-term care. You can't build overnight. And the staffing crisis that was preceding long-term the pandemic was years in the making. There was ample runway for the previous government to address all of those things. And the facts speak for themselves. 611 beds, that's it, that's all between 2011 and 2018. We're committed to building 30,000 and are well underway. But you can't change things overnight. And you heard the Auditor General talk about the long-standing issues. And she's absolutely right. Staffing, the capacity problems, the crowding problems. In terms of the inspections, again, over 8,500 critical incidents and complaints that weren't addressed under the previous government. It was our government that came in and said, look, you can't have 8,500 critical incidents and complaints just dismissed. We have to deal with those. And we took the Auditor General's advice in terms of the, looking at the risk-based approach. And certainly that having recently been done by the Ministry of Health and Long-Term Care just in 2018, we began our work as a new ministry of long-term care, a standalone ministry, the only one of its kind in Canada, because the work hadn't been done by the previous government, and we needed to focus on that. We know the crowded conditions in the long-term care homes, and those old ward rooms played a role in the infection spread. But without staff, where do you move people to? So, I just appreciate all the people that have worked round the clock for the last year addressing these horrible, horrible shortcomings in long-term care. And we've been listening and addressing these issues. So do I take accountability for repairing this? Absolutely. That's why I came to politics. I didn't expect a pandemic, but my goodness, the duty, the obligation, the responsibility to stand and defend and to change this system, absolutely. That rests with me, and I'll continue to do that.
Follow up?
Minister, I was actually trying to find out what responsibility you take for the government's actual response during the pandemic, because the auditor points out that it's not just that she points out all the systemic issues, but she also points out things about the inadequacy of the government's immediate response. So I'm asking you, what did your government fail to do adequately in those initial months of the pandemic that you're willing to take responsibility for?
So, I'm the Minister of Long-Term Care, and initially when we started, we had the inspections group and a very small capital group that really hadn't done a lot because only 611 beds were built from 2011 to 2018 under the previous government. So we were what I call an appendage ministry. So this was an integrated approach. So what I was responsible for was making sure that we engaged with the other members of an integrated response, the Ministry of Health, Minister of Labour and Training and Skills Development, and we did eventually have input to the command table, but because this was anticipated to be led by the Ministry of Health, which it was, this was something that we were a part of, but not fully integrated with. If you look at the recommendations by the Auditor General, and she acknowledges that. She talks about the importance of public health and the importance of identifying IPAC. So my role as Minister of Health was to look after increasing the capacity, addressing wait lists, making sure that we had a way forward to build capacity. But, all you have to do really is to look at the divisions that we had as a beginning ministry. We had to build the ministry, and so we also had to integrate. So what do I take responsibility for? I take responsibility for the well-being of residents in long-term care and for accountability over fixing the disaster of the last 15 years. That's what I'm accountable for, and that's what I'm trying to do. I'm not an acute care sector. The public health is its own sphere, but we have to have a much better integrated system where long-term care is seen to be part of the healthcare sector as a whole, integrated with acute care and integrated with public health, and all the groups that will allow a stronger pandemic response going forward, and better emergency preparedness. That's what I'm accountable for.
Colin DeMello, City News.
Hi, Minister. Clearly your government should have learned something after the first wave, but I'm wondering, how is it that more people died in long-term care during the second wave than during the first wave? How is it that your government didn't put out the fire, to use your analogy, didn't put out the fire between the first wave and the second wave, leading to even more deaths in the second wave than the first? Can you walk us through how that happened?
Thanks, Colin. So the first wave compared to the second wave compared to the third wave, they're all different. And I think if you have insight into, the issues in the first wave, it was lack of PPE, it was testing issues, it was crowded old wardrooms, and certainly the lack of understanding, even at the top national levels, of whether masks would be beneficial or not. All of this really points to the scientific evolution of the understanding of COVID-19. So you're looking at the federal response, which comes down to the provinces, and then the chief medical officers of health and their associates then provide information down to the ministries. And so if you look at the first wave, very, very different context. Second wave, very large, widespread community spread. Community spread really was the driver. And we finally had the testing and the lab capacity to address that and to understand how much there was. We still had no vaccines. and PPE was improved. So we had improved IPAC in the second wave. We had improved PPE. We had improved staffing. We were integrating with public health and the acute care sector, and as I said, hired over 8,600 people in to the long-term care sector by the second wave. But if you look at really the issues in the second wave, it comes back to the long-term care homes being in the regions of high community spread. Very hard to keep it out. We were also starting to implement the surveillance testing and the through rapid testing as well. The initial surveillance testing started in April in the first wave, but we didn't have the rapid tests yet. So, you have a disease that is spread by asymptomatic individuals. Some experts say up to half of the cases are spread with asymptomatic. And then you have controversy over aerosol spread. And the scientists are still, discussing whether it's predominantly aerosol or not. So that would affect our IPAC measures. And so, the COVID runs at COVID speed, and the scientific understanding is trying to keep up, but I don't think we're there yet, and that's beyond my position. And then in the third wave, we're dealing with variants. Highly transmissible, much, deadlier, higher mortality, and the inability to keep that out of our borders. And so the variants are coming in from other places, and we've seen up in Barrie what happens to long-term care when a variant gets in. The ability for those to spread quickly and cause devastating results, and that's what we're seeing in the third wave. The rapid escalation of the impact of those variants while our scientific experts discuss whether it's aerosol spread or not. And I think that's a really important part, that all three of these waves were different. There were lessons learned from each one and changes made. But it's taking all the experts who still can't agree on those sorts of things. Global pandemic where we're competing for resources. And all three were very different, but lessons learned in each one. But many of it comes back to the old 4-bed wardrooms, the staffing, and appropriate infection prevention and control with proper scientific understanding.
Last question.
Minister, I'm going to ask a question on behalf of my colleague Cynthia Mulligan, who can't get on the line. She says, Minister, you warned of asymptomatic spread, and it seems the government ignored you. Clearly, there were issues in how the government handled COVID. The AG report said that the CMOH gave confusing direction. Homes were left on their own to handle infection control. The question is, you simply can't blame previous governments, or as you're doing at the podium here, blaming everyone, it seems, in Ontario but yourselves. To my colleague's point, are you willing to take any responsibility for the bad management of COVID-19?
Well, I'm one person. This is an integrated response by many, many experts, much more expert than I am. I have scientific understanding, but we rely on the experts like all the medical officers of health in public health, the advice from the chief medical officer of health and the associate chief medical officer of health. I don't think you would want a politician determining the public health measures. This is done by the experts, and we have been listening to the public health experts this whole time. So certainly, and I do take exception to your comment, I do take responsibility for this. This is why I'm still here. I have a scientific understanding and a background, and I'm a very caring and compassionate a person who spent many years caring for the most vulnerable people in our society at their worst time of need. And so it is a duty. And we are in a war against COVID-19. And so, there's enough blame to go around in many places. I am one person, and I do take responsibility, and that's why I came to politics, because it seemed like nobody was doing anything about long-term care. And it's terrible. When we had runway, when we had the ability, like BC, to build the modernized facilities to address the staffing, it didn't happen. And that set the stage for this. So, there are structural inadequacies that are difficult to overcome overnight. But absolutely, our government has used every measure every tool. We've listened to the experts. But my point being is some of the experts can't even agree. So, we are left in a situation where we're still learning, and there are many, many lessons to be learned here. This is a 100-year pandemic. 100 years. Nobody's ever seen a virus like this. Potential aerosol transmission, the asymptomatic spread. And countries around the world are dealing with this. And Ontario's response, my heart goes out to India. My heart goes out to Brazil. My heart goes out to all these countries that are badly suffering.
Thank you.
Thank you.
NDP leader Andrea Horwath is up next, folks. Queue up, please.